So welcome to another episode of the Late Late Aesthetics Show with me, Vanessa, Lana Brown. I'm so pleased to announce that this is the first podcast where we have two guests at the same time. So thank you so much for joining me. And today we're joined by two renowned surgeons, Charles East, who specialises in rhinoplasty and has been named TATLER's top surgeon for the last 14 years, and Lydia Badia, who specialises in facial plastics and has published numerous of different papers around, the whole surgical space. So thank you so much for joining me today. It's a pleasure to have you on the podcast. So take me back to the start. How did it all start? What was your main interest in getting involved in the surgical space? And how did you really hone in on your individual specialties?
Right. Do you want to tell us about our history? So we were both trained originally in otolaryngology, ear, nose and throat surgery. But within that, there is a subset discipline called facial plastics. And that was relatively infantile when I was starting out, and I had fellowship training in Seattle, where I learned a lot of my facial plastics. And then we met at the Royal National, which then became part of UCH, and became focused on nasal surgery. So initially it was a mixture of functional, aesthetic, and reconstructive, and I spent 15 years working in the craniofacial, facial deformities. So that was the grounding for where we started. And then we were lucky enough to found Rhinoplasty London together in 2017.
That's right, yes.
Yeah. And then since then, we're dedicated really to facial plastics, but with a big bias towards rhinoplasty.
Fantastic.
Yes, that's right. Within the face, within facial plastic surgery, rhinoplasty, the nose is center to the face.
And as well, rhinoplasty is considered one of the most dangerous surgical procedures that you can carry out. Why is that? And basically, why is it so dangerous? And why do you need to make sure you're going to see a specialist who is experienced and has carried out numerous surgeries before making an informed decision whether to go ahead with the procedure or not? So talk me through the complexities involved with rhinoplasty.
It is the most complex operation that we can do within the face. And I think it's probably because one size doesn't fit all. So there are other facial plastic procedures that obviously taking into account the patient's anatomy, but the actual technique, it's been more similar. Within the nose, every nose literally is different, and it has to fit in with a very unique face.
Yeah, and actually the operation of rhinoplasty has gone through some huge changes from one that was traditionally an operation where you took everything out. It was a reductive procedure, to one that has now completely turned on its head to become what we call a preservation type approach. So the philosophy of how it was done, and it used to be an operation that took 20 minutes, and we all saw the results of that. And then the evolution of how this is developed then became more of a structural, where we had to rebuild things. And now we're moving very much towards what we call preservation. So we're reorientating, preserving, realigning. And with all the variations in your ethnicity, the age range, of course, because we, from cleft noses right up to sort of the oldest patient I've operated on is 85 for rhinoplasty. So you've got this enormous range as well as the enormous diversity within that.
Yeah.
And then don't forget the psychology of what that person wants to look like. So you have to put that into the pot as well, being central in the face. So that adds to the complexity of why this is quite a complicated operation.
So you've touched upon the fact that the procedure's changed over the years. So has the way that you carry out a surgical procedure now for rhinoplasty, is that different to, let's say, how you were carrying it out 10 years ago? And how important is it for you to, let's say, learn these new techniques, and how do you stay up to date with the new techniques that are available? And do you craft your own techniques, for example? It's like anyone who's a specialist, as soon as they start doing something and they think, I can, do it better like this. So how's that developed over the years?
It's been incredible. We've been so fortunate to be part of this. Let's actually think about this operation, because there was, as Charles was saying, purely take things out and see what happens. So the technique has changed so much. And the beauty of it is to have been able to be part of it, to understand that the cartilages, that the bones, we can remodel rather than break them. We can reshape rather than take away. It's just been fantastic to.
And I think we need to acknowledge our international colleagues, because we've been very fortunate to be part of an international research group that have been responsible in the last 10 years for most of the major advances in rhinoplasty. That is the piezo ultrasonics, preservation type rhinoplasty, care of the skin. And so our group, it's called the Wine and Nose Club.
That's a great thing. You can combine them both really, really nicely.
That's exactly. So it all started with a group of friends. Do you fancy talking about this? Okay, let's go and meet in Avignon. So the premise was, it was 4 of us originally, and now it's, I think, 8 or 9 of us, of surgeons from around the world. You turn up somewhere, you open your computers, and you open a bottle of wine, and we just talk. What are the problems? And from that, we have developed all these things. So we're very grateful to have been included in that group, because that has helped us evolve and develop.
Well, it's like any field. If you speak with like-minded people that are in the same space as you, that's how you can be as creative as possible. And then that would have led you to publish papers, which other surgeons then practice on. And that's medicine. That's how medicine develops, which is fantastic. And I think the aesthetics industry as a whole in the UK is such a broad topic. Aesthetics, everybody calls themselves that they do aesthetics, whereas it is a form of medicine, and you're treating an individual who doesn't like something about themselves or wants to correct something about themselves. So it's a lot more complex, and I just think that you need to see a practitioner that truly understands every single dynamic of that. You would have seen a big development in the non-surgical space from the time that you started doing your surgical procedures. How has the non-surgical space changed, let's say, the way that you practice? And is there still the demand for surgical procedures?
The demand for surgery is there. It's very much there, because with fillers, which is the main non-surgical technique for the nose, you cannot make a big nose smaller. And that is the commonest, not the only one, but the commonest request is to have a slimmer, shorter, less projected, overall smaller nose. Fillers have really changed what we do, and they have a great place for it. But I always feel that fillers alone are not the option to change the appearance. They are a good option to do some camouflaging, some contouring, some tweaking within the nose particularly. Botulinum toxin also has a bit of an effect within the nose in stopping some of the dynamic elements. So there are non-surgical techniques which help, but the big majority of patients wishing to change the appearance of the nose, they wish to do something which is more long-lasting, which they feel good, but not for what they perceived as a few months, but what they perceive as a change in their life and a change and a build in their confidence.
Oh, absolutely.
I think also we need to acknowledge the sort of integration that's happened with the evolution of skincare, because that was a very neglected area in rhinoplasty, how to deal with difficult skin envelopes. It would often limit what you could achieve. Okay. So now we have got a whole range of preparations that we do for the skin, for the outside, and also for the deeper tissues to stop that swelling that happens afterwards. And then I think we also would need to acknowledge the benefits of regenerative medicine. So even this is non-surgical, autologous fat transfer and stem cell transfer, and that was the commonest operation we did in the craniofacial service. But in aesthetics now, that also forms quite a big part. So you've got the option of not only hyaluronic acid fillers, collagen stimulators, but you've also got the benefits of autologous fat transfer, which has a huge potential to improve skin quality, texture, and blends in with what you do with surgery.
Amazing. With the fat transfer, so I've heard about fat transfer in the sense that you can transfer it, let's say, from the legs to the breast area. Can you and now you obviously, well, for a while, you can transfer fat to the face. Are you able to transfer fat, let's say, for for the nose to improve the nose appearance. Is that okay? Amazing.
So I mean, just on fat for a second. I mean, there's 3 different types really. There's macro fat, which is the sort of big bits, and there's a sort of
We know.
a micro fat, which is a smaller bit, and then there's another one called nano fat. So how the fat is prepared tailors it to what it needs to try and do. So if you're going to treat like under eye hollows, nano fat's a very good option for that. There is a disease called Peri-Romberg, which looks like someone's cut your face with a sword because the skin sort of withers on one side. And fat transfer, which is often done 2 or 3 times, would transform those patients who have this. It's called oncoup de sabre. It's a also cutaneous atrophy. So for a lot of patients, that absolutely revolutionized how their skin was, and then allowed us to do a proper operation underneath. So all these little integrations are why it becomes complex, why the options for treatment are getting wider, and why it becomes a very tailored type procedure.
Absolutely. So that's why it always starts with a consultation and give the patient different options that will obviously work for them. In your experience, what would you say is the biggest mistake that a patient makes when deciding on a nose job? What's the number one biggest mistake that you may have came across, LBB Hex?
So we have seen many patients that have had bad experiences in the past, and the things they say, so from listening to the patients, they say their mistake was to be taken by a deal, deciding on that based on price, and they call it, I didn't do my research then, which means they made the decision quite quickly. So that's the commonest 2 or 3 things that patients often tell us. Sometimes following trends can be a mistake, but if they consult with someone who has a view on facial appearance, they would then recommend what style of nose suits them best. So I don't think, believe it or not, that's necessarily a mistake. Oh, I want the nose like that just because it's trending. It's more to do with be taken on by deals, decisions based on price, not necessarily going to a professional and then rushing that decision.
I also think that you have to consider what's the worst case scenario that having with surgery. And, I've had patients who've been unhappy with what I've done for them, obviously to try and do my best for them. Yeah. However, you should pick a surgeon that has experience that should you have a problem, you're going to be looked after, and that problem can be rectified. So in a way, you have to balance the excitement and optimism, I want this, with, okay, look, let's say I don't get it. You need to be confident that that surgical team are going to care for you and take you through. And I think a lot of people live with regrets because then they're lost. They don't have that nice aftercare. So you remember, this is a surgical procedure. It's not a walk in the park. And we need to take it seriously. And that's what we do. We want to make sure that when we take people on, we want to care for them. So there needs to be a mutual trust and an engagement, because we'll often look after people for sometimes a year.
Yeah. So talk me through, if I was a patient coming for a consultation, then I decide, obviously you give me various different options. What's the whole procedure? How long does the procedure take? Is it under general anaesthetic? Is it under local anaesthetic? What's the recovery time? What's the follow-up process? So talk me through sort of the patient journey. If they do decide, yes, I'd like to go ahead with a surgical rhinoplasty, what would the patient experience?
Well, the first off is that we've got to be really clear that the objectives are going to be achievable for that person. So when we engage with people, we want to know as much information as possible about them, about what's inside their head, about what their aesthetic is. Because one of the disasters in surgery is the one-size-fits-all in rhinoplasty is out of the window. It mustn't be there. So that's first setting. And then, obviously, it needs a consultation with examination, pictures, and a communication about outcome. And that's where we use morphing or simulations for all of our patients. Because one thing that's really helpful is to have a visualization. You can say, I want the tip a bit higher or the bridge a bit lower. But then the patient goes away and thinks, oh,
what
God,
does that mean?
What does, it doesn't mean that. That's why it doesn't mean. So understanding, and what we have to do is build a rapport with the patient. So we need to have that mutual trust. And that's what this process involves, at least 2, sometimes 3 consultations before there's a commitment. So that there's absolute clarity that the surgeon and the patient are going for a similar goal. Now, obviously, we cannot guarantee that what we show is what's going to
exactly what's like.
But we don't want to show them something that's unreasonable, where we know from, between us, we've got many years of experience of this. So we want to show them something that you're going to get close to, but understanding that, I normally say you're usually a bit better than your simulations. Not always, but
this is an indication.
Yeah, exactly. And if the other thing then also is to understanding their evaluation of risk. What sort of risk level are they prepared to accept? Because 5-6% of patients may need to have a secondary procedure. We can't always guarantee how things heal. So all those things need to be in the melting pot. And then you need to say to someone, well, look, how are you going to feel if you're one of that 5%?
Yeah.
Exactly. Will you still trust me to look after you? Because we'll do our best to.
Yeah.
So that's maybe I've spoken too much. So just let the net. You could say the next.
So exactly that. It shows that the consultations and the assessment take a lot
of time.
Yeah. A lot of time, a lot of care, a lot of understanding of each other, and it's normally done first online now these days with a video call, which is actually patients love it because they say I do all this research, but there is so much out there. Having the initial video call is super helpful. They can then be more targeted. Okay, so you are proposing this technique with this type of outcome. So they feel, well, it's very helpful to them and to us. Then the face-to-face, the office consultation, it's great because it's like we already know each other. So we focus more on photos and Photoshop simulations. And then there is always a cooling off period because the majority of patients come out of the consultation like us, very excited.
But they need to think whether it is the right thing for them. They need time to digest all the information that you provide.
That's true, because say, for example, someone who's got a very weak chin, which happens quite regularly, their nose looks over-projected because the chin's very set back. We'll discuss a genioplasty with a surgical advancement of the chin. And when you throw that in, because they think it's the nose, but when you throw that into someone, oh my God, he's doing this. Now what's he going to suggest next? So you're exactly right. You have to sort of go through and say, well, these are your options. This is what you could look like from the simulation. And you give them time to digest that. So
and
that
come
cooling
back with questions. It's like, oh, you mentioned that. What does that exactly mean? Because obviously for us, all the words are very familiar. We know every detail within the nose, but for the patients, the first time they hear some of those words, so they need to come back with questions. So the journey typically is a lot of the assessment beforehand, cooling off period, come back with questions before making a final decision.
Yeah.
If the decision is then made, the operation is not a 20-minute mole removal. It's actually between 2 and 3 hours.
Oh, okay. So it's general anesthesia.
It's a general anesthesia.
Well, there are
an update case. So patients come into a proper hospital. We work in a very reputable establishments within central London. And they come in the morning and go home in the evening. The anesthetic is fantastic in how quick actually people recover, but the operation itself under general for 2 to 3 hours, which is a good thing. I always say, if anyone is like 40 minutes in and you're out, oh my God, you can do a lot of damage in 40 minutes.
Wow, yeah, exactly.
And then patients, just to finish off on the journey, then patients have a bit of a miserable first week when they are at home.
Bandaged.
A bit bunged up, a bit congested, a bit of pressure, with the cast on, with puffiness, a bit of bleeding. We always say, you don't look good that first. And then when the cast is removed, that's always a very emotional moment.
Of course.
But then the healing continues, of course. But it's about a 10-day downtime for people to be off work, of socializing, of exercising. 2 weeks before they safely travel by plane again. So I always say it depends on your profession. Allow 10 days to 2 weeks. The second week, with most people being able to work from home now, you're probably okay to...
Yeah, maybe after a couple of days recover, because you know it is trauma for the body, so you have to allow your body to be able to recover and heal itself, which can take some time.
Yeah.
The might rush to sleep, convalescence. That's the...
But around that, the sort of the little marginal gains that we aim for, making sure the skin's prepped, that the oil's reduced, that they haven't taken drugs that make them bruise or bleed beforehand.
Yeah.
There's a detailed pre-assessment by the hospital. They get contact by the anaesthetist, so they have a chat for all the things that worry them. The anaesthetic team, I have to say, over the years, we've evolved a technique where it does not hurt. They wake up with no pain.
Well, that's the main thing.
And so people say, well, is it really going to hurt? Because when I banged my nose, I said, no, you'll wake up, and this would all be completely numb for probably 8 or 10 hours. And that gets them through the first day. They don't need strong painkillers. And it also, I mean, day 2 and day 3, you're a bit puffy and feeling a bit low energy, but they very quickly get better. And by day 10, I say, look, you can probably be presentable face-to-face by day 10.
Fantastic. So what's your take on celebrities influencing how a patient views their nose or demands what type of nose job that they would like? Have you seen patients coming into practice where they provide you with an image of a celebrity and say, I want to look exactly like this celebrity? And how do you manage that situation? Do you have to turn them down? What's your go-to? And has it changed the way that you have to practice now?
Almost everyone. So when they have an issue with their noses and their appearance, they look at other people's noses and they have an opinion. I like hers, not his. No. The majority of people come with an image of noses they like. And that's not a bad thing. I think that's actually quite helpful, because if they like all the noses which are very scooped and turned up, that's the style they like. So that's not necessarily a bad thing. But sometimes, like occasionally, they choose a celebrity that looks nothing like them.
Well, everyone's face shape is different. The width of their face is different. Ethnicity plays a big part. So
yes, there was once that the ethnicity was completely so different. I'm like, I
know, it's not going to work.
But the biggest influencer some years ago was Kim Kardashian, and we've had requests for her style of nose many times.
Yeah,
but it's
Scarlett Johansson.
So
there's a range. I mean, I think one of the ways in which that can be unrealistic, but can also be helpful. So, well, I'll normally say to someone, look, if you like a style of nose, or if you see one on our Instagram or our website, or screenshot it and bring it in, what that does is adds to your sort of knowledge about what that person's aesthetic, how they want to see themselves. And to be honest, most patients will pick surgeons based on the kind of style of nose they create.
Because everyone's...
So it almost becomes self-selecting in a way.
Yeah.
So we're sometimes asked to do extreme, odd thing. But most times we're asked to do natural, what's going to suit me. I would say that's by and far the biggest request.
Perfect. Have you seen any trends on Instagram or TikTok that you think that just need to stop? I mean, look, things are trending all the time with social media now. I think it's a very different space to what it was when you probably first started doing your surgical procedures. Have you seen anything that you categorically think, what is happening? What is going on in this video?
I think social media is fantastic in many ways, because things are out there. The thing that must stop, in my opinion, is fake. The things which trend, which are unreal. And it's like most people are now educated enough to understand that there are fake appearances.
Yes.
But if people genuinely express their journey and their opinion and how it looked, that's my example. I think that's fantastic. The one thing that must stop, again, in my opinion, is putting things which are extreme to cause sensationalism, to cause a big, oh, wow, so that's going to trend just because it's obscene or extreme.
Yeah, exactly. I've seen on TikTok, I've seen several surgeons that are doing this big, so if someone's got, like, let's say a large nose, they're, really shortening the nose, and they're doing a really upturned look, but not taking into account that individual's structure, which is crazy. So rhinoplasty is actually the third most performed cosmetic procedure globally. And why do you think that is so popular? Why is that procedure very popular?
Well, it's very popular because it's on your face. It's one of the things that if one has an issue with appearance, that one you cannot hide.
Yes.
You cannot dress in a certain way, you put certain clothes on, a certain makeup, that you cannot hide. But also, it's not gender specific. We've got many male and female patients. It's not age specific, so it's not like facelifting that you tend to be in your more mature years of life. So we have all age ranges and all genders. So by per se, the population is bigger, and it's quite obvious.
Also, a psychology about the nose seems to attract a lot more interest in terms of moving and changing it than other parts of the facial skeleton, and the psychology behind why people want to change it and how they catch themselves and how the lighting is. For some reason, the nose is far more of a target than, say, cheeks or chin or eyes.
I think it is an integral part of the face, because I've seen before and after images from surgical rhinoplasty, and it completely transforms that individual's appearance.
Oh, yeah.
Completely transforms. So it just is such a crucial part of your structure for your face.
We have many patients like that, who either had bad trauma or born with a very, very unattractive nose in an otherwise beautiful face, and it absolutely transforms them.
And they say that is the way they say it is that it's like living a free life.
Yeah.
After surgery, I don't have to think about my nose all the time.
No, it is. It's life-changing, definitely. So just going back to social media, we briefly touched upon the Kardashians. 55% of plastic surgeons report that social media has completely shifted their practice.
Yes.
Do you, if you were to summarize it, do you see this as a benefit to the way you practice, or has it made your life more difficult because you've got more of an expectation to be able to manage?
Oh, in my opinion, it's been a huge positive. It's given people the feeling of accessibility. So it's not just a few selected group that can have surgery or anything really. So it's like, suddenly social media brings it closer to the majority of people. They can see like real life results. They can see what it means for other people's. You could say that expectations sometimes, but as long as expectations are managed, I don't see what's bad about social media.
No, but it's true that the expectation and the standards are going up and up and up. When we compare surgical results from the sort of 70s and 80s to now what's expected, that they're worlds apart. But
another positive.
It is another positive, and because now you can post things, this is a real result. People say, okay, well that's achievable. So it's great, and we use it. We're quite active on social media.
I think social media,
and it's a very good way for people to research, doing their sort of research.
Yeah.
However, you have to sort of put a caveat on that to say, look, a lot of misinformation is out there as well. So
there is just a lot of information.
Yeah, but a lot of it posted up is not really relevant to modern surgery. And I look at things, I think, gosh, I hope no one reads that because it's just not right and it's giving the wrong message. So at the end of the day, in terms of it can add a bit of confusion. And it's always very important to try it and seek out, although you may get tempted by that, asking questions, having word of mouth reference is still very, very important. Or professional colleagues who recommend colleagues will get you into that sort of pathway.
Exactly. Well, even before you came on the podcast, Charles, I was aware of you as being the top surgeon for noses in the UK. So your name's mentioned a lot, but you've built that over an extensive career, which is fantastic. And you continue to push the bounds when it comes to what you can do and develop obviously new techniques, which is fantastic. So medicine's always developing. It's always advancing.
We have been innovators in rhinoplasty surgery within the UK. That there is no question about it. And we are very proud and also quite excited that, because, at the end of people's careers, sometimes we've seen other colleagues that start slowing down or lose a bit of interest. We've been so fortunate that it's been totally the opposite. It's like it's just getting better. We understand it better. We are able to perfection it more. It's like gone better and better and better. And social media has been a big part of it.
It's a lifelong learning experience, rhinoplasty. And I have lots of people that come and watch and want to sort of learn, and I teach. I'm going to be the president of the Rhinoplasty Society of Europe this year. I always say to I'm not sure whether it's a good thing or a bad thing. But
you have the wine, they'll give you the wine, and you can be as sort of like academic and as creative as possible with the wine.
But one of the things that's happened, I think, in general in plastics is it's becoming regionalised. So the general sort of surgeon who could do thighs, tummies, boobs, face, nose, will move because now it's becoming regionalised. And because of that supra-specialisation now, you're like us, we do, it's 80% of our work. The standard has to get up and up and up. So all of those things sort of mean that it's a constant evolution.
Mm. And yeah, you're right. You've got to be able to specialise in one area of the body. And I think it's worth touching upon that rhinoplasty isn't just used for cosmetic purposes. There's quite often times where, let's say, somebody may have broken their nose, for example, and they may not be able to breathe properly. So that's a completely different patient that you're going to be treating. You're not treating them to just improve the overall aesthetic appearance. You're actually treating them to improve their general health and their functionality and get that function back into the nose area. Okay, great. So let's move on to fillers. So we basically said at the start that fillers have definitely changed. They're new. Well, they're not new whatsoever. However, the application of them being used in the nose area is fairly new. It wasn't really happening 10 years ago. So what are your take on fillers being injected into the nose area? How safe is that? How long does that last? Is there any place for fillers when it comes to the nose area? And would you carry out that procedure yourself?
Lots of questions there. Lots of things.
Have a discussion between yourselves about this.
No, if we start from the basics of the anatomy of what's around there, it's a dangerous area to inject. And the reason for that is the blood supply, the arteries and veins have quite considerable variability. And there are communications between the two systems so that in a bad case scenario, the filler or the injectable can pass into somewhere that can cause a devastating problem such as blindness or loss of the skin, just dying.
Wow.
And so it has a higher risk area than other parts of the face that can be injected. And that's number one. I mean, I think in the early days, we saw quite a lot of people who had their noses overfilled and it kind of stretched the skin. So the skin didn't have a good blood supply. It was over tensed. And then you get little infections and spots all over the nose and then the top layers slough away. So we've dealt with quite a few problems where the skin hasn't died, but it's just had too much put in it.
Then the fillers migrate. They don't just stay where you inject them within the nose. They can make the nose sometimes look twisted because they don't stay just there. As the nose drains, the lymphatics go from the nose right under the eyes, and the fillers therefore block
The lymphatics.
So we've seen people getting a lot of puffiness after nose fillers.
So it's really important the type of filler there. Well, it depends what you want to try and achieve, but in the nose, you really want something that's very stiff, that solidifies in a capsule, that doesn't migrate. Yeah. Migration's a real problem because then you get this diffuse sort of shiny, you lose all the shadow lines, the naturalness of the nose. And many times we've had patients who've got this sort of blue tinge to their skin and you have to wash it all out and then you do a surgical result. And they stay swollen for quite some time because of the presence of the filler. And it's important to also know that fillers don't disappear quickly. In the nose, we find them sometimes 5-10 years after they've been injected. The ones that integrate into all the tissues, you get this sort of cobweb-like appearance where the whole tissue is boggy. And it's quite difficult to plan a rhinoplasty when you've got that scenario, particularly when it's got itself insinuated in all the sort of tissue planes. So I
think that the one thing that if you ask, what has to stop right now, I'm afraid I'm going to be quite brutal. What has to stop right now is to treat fillers as if it is an innocent little something to do when you're having. One thing, you have a facial, you feel good. You don't go to a doctor, I want, oh, and then they inject fillers in the nose. Oh, when I didn't have a problem with the nose to begin with.
But they've got a little bit left in their syringe, and they
just
say, "Oh, we'll just put a little bit here, put a bit in the temples."
And it's like, what? Where is the actual advice? Where is the recommendation? Where's the consultation? It's not like walk around with a syringe and what?
No, it's great.
They don't even have a consultation proper about the nose.
Well, it also comes down to the regulation of how fillers are used or injected in the UK. I mean, we are unique in this country in so much as
In a good.
it's often referred to as the Wild West here. And I think, for something important like your nose, if it is specifically your nose, you need to go and talk to someone who is an expert in all aspects of the business. You asked us whether we use fillers. Yes, of course we do. And there are some times when it's a very useful adjunct or replacement for, say, an operation. However, you want the opinion that's going to give you the best chance of success in the long term. And I think, therefore, it's beholden for you to go and talk to a rhinoplasty expert. Okay, first off, someone who is an expert on all aspects of how to treat the nose.
Yeah, definitely.
Yes, and also take away some patients say, I regret it because it was a waste of time and money, but, I'll just try some fillers to see if surgery could be for me, like a trial of a filler to see whether then surgery would be. And it's like, who advised you that?
Exactly. Who said to do that? But also, if somebody had quite a lot of filler injected in the nose, they then wanted it removed, how do you remove that filler? Do you have to go down the surgical route, or?
I normally tell the patient, go back to the person who injected you, because they know what they've put in and where they've put it in. And it's really up to them. If you say, I'm going to have an operation, I want you to help relieve this. Now, the problem with hyaluronidase is it will break up the bonds between the hyaluronic acid, but it doesn't actually get rid of the whole product. So I would say to someone, if you've got filler in the nose, go back to who injected you, ask them, you need to be injected with hyaluronidase if it is hyaluronic acid. Now, sometimes patients are a little less forthcoming with the truth about what's happened.
Or they forget because they had a bit of filler hidden there. And
It's kind of like it wasn't an event. And then in the middle of an operation, suddenly there's a bang. There's a sort of an explosion
of gel.
And,
Wow.
I mean, it happens probably at least once a month where I find, oh, okay.
You should never said this to me, yeah.
So then we have to sort of use hyaluronidase, but then physically we can actually sort of remove that and wash it all out.
So physically, when you're obviously operating, you're able to you can access that, and you can technically just take it out.
Or if it's in a nice gel lake, yes, it comes out like a sort of, it is the jelly.
Squeeze it out.
If it's insinuated in all the tissues, you get this sort of, it's almost like a thick underlayer of carpet. It's that sort of spongy sort of layer.
It's a bit more complex. Do you?
Yeah, that's a little bit more difficult to deal with. But I mean, you may see on Instagram, there are one or two pictures of us operating and filler comes pouring out.
Wow. Surprise. So what's there? Okay, great. So let's move on to some truths and myths. So rapid fire. So say whether this is a myth or is it true. So rhinoplasty results, are they permanent?
Chance?
Go. You're like, it's good, a complex situation.
Let me explain the yes. Yes, in that an operation changes the structure, for sure. No surgery really is permanent because we all change. We all age, the structures. So it's permanent, yes, but it will not stay identical in the first month, in the first year, in the first 5 years, in the...
And we age, we change. Over time we change. When we age, our bone structure naturally changes. The fat that we have changes in the face. So all of these factors will
change. So they still carry on. Yeah. But it's also, I think, the issue about what, someone says, well, my nose was look good for 6 months, but now at 18 months, it doesn't. It's changed. And that's often procedure dependent on what was done, how the frame was perhaps destabilized and not secured, that it looks okay. But then remember, rhinoplasty healing sometimes can be between 2 and 3 years.
Oh, before it actually settles within
before everything is full. Lots of factors in that. So you'll get a good result. You'll see an early result by sort of 6 months, and you'll see a refinement that often continues sometimes 12, 18, 24 months, depending on your skin type. So that there is this evolution, and that's what makes it so challenging. And we've got to think about what's that nose going to look like, not when the plaster comes off, because that's what they'll see, but what's it going to look like in 1 year, 5 years, 10 years?
But I suppose that's why you say with regular contact with your patients, you'll do reviews on a regular basis.
Well, that's why it's important that anyone who has that surgery, the commitment is that we need to follow you up to make sure that you get to that position, because you have a chance that we may need to do something extra for you.
Exactly. Okay, so is it true that you can get the exact same nose as a celebrity? Yes or no?
No.
Happening.
It's not like shopping for a Chanel hideaway. You cannot pick one.
I'd like that nose, P.
Can have that one. Actually, that one today, but maybe in 2 years' time I'll have another one. No.
They can't change it
So styles of nose, yes. I want a low concave bridge and a slight break of my tip, and I want to be snipped. Yes, like her nose.
Yeah.
Yes, that's reasonable, because then you're defining the things that need to change for that.
Yes, exactly. Okay, is it true that non-surgical rhinoplasty is the same as surgery?
So that question before you.
I think some people think that it's the same. Sometimes it's advertised as the same. So
I think
as a patient, as a consumer, it's very confusing.
It is the word. I think maybe we should name it something else, because the word rhinoplasty, otoplasty, blepharoplasty, rhinoplasty, the word plasty means plastic surgery. So rhinoplasty is changing the nose by surgery. Non-surgical rhinoplasty is a misnomer. If it's non-surgical, it cannot be a rhinoplasty. So we could call it whatever else. We could call it
contouring.
Yeah. Nasal shaping, or
whichever word is sexy for the PVA.
But they are poles apart.
Yeah, definitely. Okay, so just to summarise, what is your number one piece of advice that you would give to somebody considering surgical rhinoplasty?
Work on yourself first. What are your motivations? Talk to your loved ones, your relatives, your partners. Be sure that this is the thing that you really want. If it is, and for many people it is, I always say there are people, I've got a very good friend who has quite a big nose, but it's never bothered her. And she's amazing because she's very appearance conscious, but the nose is not her problem. She's got other issues. But if there is an issue with the nose, unfortunately for people, you don't grow out of it. That's another myth. You'll be okay, mother saying, I love you as you are. You'll be able
to live with it.
That's the worst advice.
It's the worst advice. Yes. If something bothers you on a daily basis, you concentrate on that. You look at that specific thing in the mirror every single day.
A lot of time.
So if anything, it builds up and it builds up to the point where you are then making the decision that you really want to change that. You want to do something about it.
And exactly that. So the first piece of advice is to come to that decision with the maturity and with your expectations of, obviously everyone is a bit anxious, the thought of having an operation. That's understandable, but to work on yourself and on your motivations. After that, I would say, for a consultation, please seek someone who is a specialist so that they can give you an honest, just with integrity, on what they believe is the best for you. And it's like, I think to myself, if you were my daughter, if you were my best friend, would I be recommending that?
Yeah, exactly.
Once you've chosen a good specialist, you might need to see more than one. In fact, I think there's nothing wrong with having different opinions. Just the opposite. It can be super helpful. But if you have 20, it can be
confusing. Exactly. It's too confusing.
But 2, sometimes 3, to kind of be 100% certain that that's what you're going to do. And then once the decision's made, the consultations happen, the day has come, then trust the process because you've done the work
Exactly.
beforehand.
Fantastic.
Yeah, it's a mutual trust. I think that's so important, and it's something that we realise that building a rapport with your surgeon and the patient is really important. And the anxiety, I mean, I think we all should to talk about that emotional roller coaster that people go through, because when you look in the mirror in the first weeks afterwards and it changes from day to day, that often makes people feel very unsettled. Oh my God. So, these sort of monsters appear about what's happening, what's going on. And so being certain that they have that resilience to deal with the journey. And sometimes we employ colleagues, psychological colleagues, that will help an independent person. Although families are wonderful, and there's a wonderful quote that a mother gave me once, I just suddenly thought about it. She said, came with her daughter who had an unattractive nose and wanted to change. She said, look, as a mother, I wouldn't want my daughter to do anything that harms her or puts her at risk. He said, however, as a person who's gone through this operation myself, I know how it changed my life, and what I want is the best for her. Which was, I thought, such a lovely, and I thought, whoa, that's so nice. But then having the support of people around you going through that is also really, really helpful.
Absolutely. Well, thank you both, Charles and Lydia, for your amazing insights into the fascinating world of surgical rhinoplasty. If our listeners would like to contact you, where can they find you?
Well, through our website.
Rhinoplasty London.
Great.
Rhinoplasty London.
Instagram,
Rhinoplasty_London.
we'll tag it when we post this. We'll tag it in there. So you sure that. Perfect. Yeah, we'll post something.
Facebook page, we're on LinkedIn, and
So many places on the wonderful.
we have a phone number too.
Yeah, the old school. If you need it, should actually most likely WhatsApp you or something like that. Be easier. Well, thank you so much. You've been brilliant guests, and make sure anyone listening, make sure if you've got any comments, please comment and subscribe. Thank you.
Very much for having us today.